Hi, Dr. Blake. My name is Emily Dunning. This is my case study number 2 assessment video. I'm going to give you a quick scan of my room. Okay. I'm going to give you a quick mirror view of my camera. Okay. So before we get started, I will let you know my subjective health history question. So the symptoms I want to know about the quality, the frequency, the duration, the onset, the location, and the circumstances he's in when they occur for all of the symptoms. I'd also want to know whether these symptoms affect his activities of daily living. I would also want to know whether or not he has any history of injury or disease. And then I would want to know whether he's on any medications or substances. This would include smoking. And lastly, I'd want to know about his self-care behaviors, so whether he wears any protective equipment at work. So I'm now entering the room. I'm sanitizing my hands. I'm wiping my stethoscope, and I'm donning gloves. Hi there, my name is Emily. I'm going to be the nurse performing your assessment today. Is that okay?
Yes.
Can you state your name and date of birth?
Thanks, Dan. My date of birth is August 11th, 1993.
Okay, great. So note that I've given the patient 5 minutes privacy and returned. So we're going to get started on the ears. I'm looking at the ears. They appear symmetrical and there is no discharge. I am palpating the pinna, auricle, or tracheus. Did you feel any pain?
No.
Okay, so no pain, no tenderness. And I'm now doing the whisper test. You can repeat back what I say. 1
yellow 3. 2 blue 7.
Okay, so patient was able to repeat it back. There is no apparent hearing loss. The nose, we're looking at the nose, and it appears to be midline. The septum is midline. There's no discharge, no crusting. We're looking at the sinuses. Does that hurt?
Nope.
Any pain here?
Nope.
So both the frontal sinus and the maxillary, no pain, no tenderness. Moving on from that, we are looking at the mouth. So the lips appear to be a normal pink color and they're symmetrical. Can you open your mouth? The gums appear to be a normal pink color, no swelling, no bleeding. And the teeth are present, no apparent caries. Can you stick out your tongue and lift it to the top of your mouth? The tongue is a normal pink color, and it has no lesions. And then open your mouth again. This hard and soft palate are normal pink color, no lesions. So now we will be testing for the cranial nerve number 9, the glossopharyngeal, and the cranial nerve number 10, the vagus. So if you can stick out your tongue, say ah. So saying ah, the patient's uvula and their soft palate do raise, which is normal, and means the nerve is intact. And now we will test for the cranial nerve number 2, the hypoglossal nerve. Can you stick out your tongue, move it side to side, and say light, tight, dynamite?
Light, tight, dynamite. So
the patient's tongue was midline, moved side to side, and he was able to pronounce light, tight, dynamite clearly and distinctly, so the nerve is intact. Moving on, we will be looking at the neck. So I'm looking at the neck. It appears to be have a slight pallor to it. There appears to be no apparent lesions or scars. And I'm just going to be palpating. So the trachea appears to be in position. There is no obvious thyroid enlargement, and the neck is symmetrical. So moving on from that, we are checking the carotid pulses. So I stay here for a minute. I stay here for a minute. And the patient's rate was 70 beats per minute, which is normal. The grade is a 2+, which is normal. And it is, rhythm is normal and symmetrical on both sides. So moving on from that, we will be testing the cranial nerve number 11, spinal accessory nerve. So can you turn your head towards my hand, and shrug your shoulders. Okay, so patient was able to do the actions against resistance, meaning that the cranial nerve is intact and there's no muscle weakness. It's equal bilaterally. Moving on from that, we're looking at the upper extremities. The upper extremities appear to be have a slight pallor color to them. There's no obvious lesions or scars, and it is symmetrical on both sides. I'm now palpating, so note that I palpate along the clavicle, the glenohumeral. I'm taking my time with the skin here and the muscles, and then I am on the elbow joint. I'm doing the olecranon process and working my way down the radiocarpal, the midcarpal joints, and then the phalangeal joints. Note that I do the same thing for the other arm. So upon palpation, there was no swelling or edema. The temperature is mildly warm, which is normal, and turgor is normal, so the skin returns to normal quickly, and Also, there was no palpable lesions or masses. So moving on from that, we will be doing the APT ratio. Sorry, not the APT ratio. Moving on from that, we will be doing the nails. So we're doing a capillary refill check, and it is normal. The color returns to normal, and there are no lesions, which is normal. So moving on from that, we are going to be doing range of motion. So if you can flex your fingers, extend your fingers, flex your wrists, extend your wrists, ulnar deviation, radial deviation, and then we need elbows. We're going to flex, extend, then we're going to go like this, supination, pronation, and then for shoulders, we're doing abduction, adduction, and then we're doing external rotation, internal rotation. So did you feel any pain?
Yes, felt pain here.
Okay, so the patient felt pain in his left shoulder during internal rotation. So because of that, I'm just going to do a quick passive range of motion test. So I put my hand here to feel for crepitus. Did you feel any pain for that?
Yes.
Okay, so I didn't hear any crepitus or feel any crepitus. Note that the patient does feel pain and has a slight decrease in range of motion for his left shoulder during passive and active range of motion for internal rotation. So moving on from that, we will be doing the radial pulses. So I hold here for a minute. The rate is 70. The rhythm is normal. 70 beats per minute. The rhythm is normal. It's equal on both sides. The brachial pulse is 70 beats per minute. Equal on both sides. The rhythm is normal. And then grip strength. If you can squeeze my fingers. So grip strength is strong and equal on both sides, which is normal. Moving on from that, we're looking at the thorax. If you can turn around. Okay, so the thorax appears to be on inspection symmetrical. It's a normal ellipsis shape. There are no apparent skeletal deformities. The color does have a slight pallor to it, and the skin does appear to be a little moist. So I will do an APT ratio. So the anterior posterior is smaller than the transverse diameter, which is a 1:2 ratio, and that is normal. So I now will palpate the entirety of the thoracic area. So I do the entire thing. And I did not palpate any lesions or masses. The skin was moist and clammy in feeling. And then if you can breathe in, so chest expansion is symmetrical on both sides. Moving on from that, we are going to be doing percussion. So I'm just going to percuss. Okay, so percussion, note that I do continue on for the other 9 landmarks on either side and to compare them. Percussion, the resonance is normal, so it's low-pitched, it's hollow, and it's clear, which is good. And now we will oscillate. Take a deep breath in. Take a deep breath in. Okay, now I continue down. So note that I heard normal vesicular sounds, apart from the adventitious sounds I heard in the base of the lungs. So in position 7, I did hear crackles, fine crackles, in the lower left and right lobes. And I took a minute to check the rate. The rate is 24 beats per minute, which is tachypnea and abnormal. The rhythm is normal. The quality is shallow. And because of the adventitious sounds, I'm going to quickly test for bronchophony. So can you say 99? 99. So his voice sounds were dull and muffled, which is normal. And I charted everything accordingly. Thank you.